If you have psoriasis, you know how difficult it can be to deal with. The red, flaky patches of skin, most commonly on elbows, knees, scalp and lower back, can be itchy and sore, and flare-ups can be unpredictable. Psoriasis can also have a large psychological impact, and many people with the condition say that they feel self-conscious and anxious when speaking with people or going out in public. What many people with psoriasis don't know, however, is that there is another related condition that they should be aware of. Psoriatic arthritis, also known as PSA, is an inflammatory joint condition that can affect people with psoriasis. Around 3 out of every 10 people with psoriasis will develop PSA, but it doesn't just affect those with severe skin symptoms. PSA can appear in people with mild psoriasis too, which they may not even have noticed. Therefore, if you have psoriasis or psoriasis runs in your family, you need to be aware of the signs and symptoms of PSA so that you know what to look out for and can be assessed if necessary. Changes to nails, such as pitting, discolorations, or lifting from the nail bed, can be a sign of PSA. Just like psoriasis, PSA symptoms vary from person to person, but typically include stiffness, particularly in the morning, pain, swelling, and tenderness in one or more joints, including the back and neck. Toes and fingers may appear swollen, but remember that PSA can also affect larger joints or areas where tendons join to bone, such as the knees, spine, and lower back. PSA can also cause overwhelming feelings of fatigue. This joint pain and the resulting difficulty in getting around can also have a significant impact on how people feel about themselves and their ability to cope with everyday life. People can become worried about the future and experience feelings of depression or anxiety. At its worst, the pain can be debilitating, affecting work, recreation and sleep, impacting on your quality of life, and in some severe cases, there is the risk of the joints becoming permanently damaged. The most important thing to know is that PSA is a treatable condition, and with the correct effective treatment and by making the right lifestyle choices, like staying slim, being active, not smoking, and drinking alcohol only occasionally, you and your doctor can manage your condition together. Recognizing and diagnosing PSA early is essential to managing the condition, and so people with psoriasis should expect and ask for an annual check from their doctor for any signs or symptoms of early PSA. It is important to be aware of the various symptoms of PSA, and remember that any of these signs may be related to your psoriasis. If you do notice any possible signs or symptoms, make a note of them and discuss them with your doctor who, if necessary, can refer you to a rheumatologist, a doctor who specializes in joints, for assessment. So, if you or people in your family have psoriasis, don't forget to look out for PSA. If you identify PSA early, it can be managed through effective care and support, and you can live life to the full.